Now, over 600,000 adjustments, you must have learned quite a few things over there. And I want you to talk a little bit about this rabbit hole of consequences you've seen that have led so many people into bad health decisions. Is there a pattern that you've seen over those 40 years of why patients are showing up to you? Is it just a lack of health? Is it a lack of knowing? What have you seen?
So you mentioned coaching. And so if you look at a doctor, people go to the doctor as an authoritative figure to see what options they have.
Yeah.
And so the doctor's job is to teach them or to kind of give them a direction or a path to get out of this unhealthy consequence they're in. So what I see typically is people have already been to the doctors first and they decide to try a chiropractor. So I had to kind of, in essence, hunt and fish in the woods. You got to get really good at it, right? You have to learn, details matter. You have to teach them. You have to find out what their bad habits are. And most people have bad habits. And that's what kind of working with athletes. Coaches have athletes, coaches coach athletes for a reason, to make them better. And the definition of a coach is to get an athlete to a place he can't get to by himself. So that's the definition of a coach. And so my job as a doc, so I see all these last resort people, over the 25,000 patients that came in, there were only like 10 to 15 medical referrals. So it's kind of crazy where they found their way through the food chain to me because things aren't working. So what do I get a chance? I get my own research study before my eyes. I get a chance to see what's causing these breakdowns and their bad habits and what's causing them to have this stress and anxiety. But the number one thing, I know one thing, Cass, which is unique, is most people who are in physical pain, they got mental issues too. They have mental. So most people come in hurting physically are in a cranky mood. They're in a bad mood. They're short-circuited. They talk a lot. They're just trying to get out. They're trying to find an answer for it. So I think what happens is you find the brain's nature is to protect the body. The subconscious brain, you have the sympathetic and parasympathetic system. And the sympathetic system kind of runs people's life in addition to the conscious brain. So you have these thousands of thoughts, I call them bubbles. So you have these bubbles coming off the brain, and it's communicating with the other brain, which is the protective mechanism and the calming mechanism. And if we look at that brain, that's out of balance. So most people live the stress and anxiety life. They don't live the calm life. So the calm life is understimulated. So I'll talk about what we can do to stimulate the calm life to bring that into better balance. And what we could do after we do the adjustments, but how we could kind of get this thoughts and this security system, the sympathetic system, kind of that's always in this tug of war. It's this tug of war of thoughts, and it causes this stress and anxiety life that people are trying to deal with themselves from within. And we know a lot of diseases tap in the stress and anxiety state. I've never had anybody come back from Hawaii after a month saying, "Doc, my blood pressure's through the roof." That doesn't happen. They stimulate the calm. So one thing I found, I have a little model. I don't know if you can see it, but we look at the nervous system, and when that vertebrae shifts and impinges the nerve, the brain reads that now, and the brain's job is to protect you. And I find as a result of the person in pain, the brain kind of shuts down the dopamine, shuts down the serotonin, shuts down endorphins. Why? Because it doesn't want you to hurt yourself even more. So now people are saying, well, I got a cranky mood with physical pain. So I need to eat more sugar. I need to eat drink more alcohol. I need to eat food. I need to kind of wake up my brain. So they think the brain is separate from the body or the physical part. And when I find I reboot the nervous system, when we do adjustments, it opens up the system. And now the brain reads that and says, oh, cool. We could open up the patient. We could give them the dopamine, serotonin. So this brain is this dimmer switch thermostatic mechanism that reads the body and shuts it down to protect it. It doesn't want you to do more to hurt yourself. So it's kind of like an internal situation where it doesn't want you to do more harm to the body. So people use typically mental drugs for mental issues and physical drugs for physical issues. They don't see that mind-body connection. So the best thing about the largest drugless health profession, the chiropractic profession, if it's done properly, you could actually kind of get pressure off the nervous system, and the brain's thermostatic mechanism opens up, and that's how you can help people with mental illness and mental struggle, people with mental struggling issues. And I put those people on Instagram just to show the people that have come in after seeing all these doctors, and you kind of figure out what they're doing, and you get really good at finding what their bad habits are.